topics about the NHS are bound to come up in at least one of your interviews. So let's talk about them. So NHS topics are a great way to gauge how up to date you are regarding issues surrounding the system. What makes them really popular is their versatility. They can be asked in a traditional interview or in an MMI. So it's going to hold you in good stead if you're well versed in them in case they come up on the day of the interview. Even if you don't get asked questions about the NHS directly, you can use them as a springboard or a leeway and include examples pertaining to the NHS to answer questions related to medical ethics, for example. So for example, when you're answering something about autonomy, you can use the Charlie Gard case, which I'm sure all of you are familiar with. Again, this is one of the NHS hot topics that was quite relevant a couple of years ago when I was preparing for the interview. And questions about ethics and medical ethics are definitely going to come up in mostly every single interview that you guys attend. So I'll be dropping a video on that in a few weeks' time, so click the bell in the description below if you want to be notified. Anyway, this video will expand and elaborate on the most popular NHS hot topics in the last couple of years, and hence the NHS topics that are bound to come up in your interview. Don't worry, you won't be asked the really niche details and the really niche questions about, for example, how many people downloaded a fitness app over the lockdown period. The answer is more than 3 million, by the way, if you really want to know. Instead, you'll be asked questions that have affected the whole of the NHS, or on the flip side, you can be asked questions about topics that have not yet affected the NHS, but have the potential to do so. I'll be mentioning further topics to be aware of, but simply don't have time to talk about in this video at the end of the video, so make sure you stick around for that. Anyway, let's start with the first hot topic. The first hot topic is the NHS Long-Term Plan. This was set in motion 2 years ago to celebrate the 70-year-old NHS. It was a plan written by NHS England to make sure that the NHS remains sustainable for the next decade, so until 2028. For a long time now, there have been increasing concerns over the funding, the shortage of staffing, and also the pressures that have been put on the NHS due to the aging population in particular. So what makes this plan any different? Well, with over 200 different events and 85,000 people involved in the making of this plan, the organisation is optimistic that enough attention will be made to enable that resources are given out to the front line in the most effective way possible. To understand the NHS long-term plan better, it's important to go back a few years and have a good understanding of the NHS 5-year forward view, which was put into motion in 2014 and is already making a huge impact on today's healthcare system. More focus has been placed on prevention rather than cure, and greater accesses to services such as out-of-hours GPs and urgent care centres. CCGs were a main component of the 5-year plan that was put in place in 2014. So CCGs are basically groups of general practitioners or GP, and they get together to decide how funding from the government can be distributed. With them being the centre of primary care, it can be argued that they have the best understanding out of all the other healthcare professionals on the needs of their local community. So success from the 5-year plan has enabled the vision of those creating the NHS long-term plan to now appear more realistic. And this is desirable if our country is to maintain the NHS for the foreseeable future. So what are the goals of the NHS long-term plan? By the way, if you're keen to read more about this, I'll leave a link in the description below. Otherwise, here are a few objectives in short. The first one being, like I mentioned earlier, prevention over cure. This is the most important, and this prevention will come through NHS funding programs, group sessions, and major media coverage. a greater care will be placed on the person's personal needs. Another point is improving the quality of community-based care prior to hospital admission, services closer to people's home with quicker access to treatment. Another point is each patient will have the right to online GP consultation, greater investment in cancer treatment. The specific aim here is to diagnose cancers early from 50% currently to 75%. Another really important point of the long-term plan is to empower people to help them better manage their chronic conditions, especially diabetes, which is the main focus point currently. And last but not least is increasing the number of nursing and undergraduate places to ensure candidates who would serve the NHS well are not turned away, which I guess is a good thing for us. Now the second topic is high street heart checks, and this is a part of the NHS long-term plan as well. Like I said, prevention is better than cure and it's a lot cheaper too. So the gist of this is that general practices and pharmacies are offering rapid detection for one of the all-time leading causes of deaths in the UK, cardiovascular disease. Now, cardiovascular disease is responsible for around a quarter of all deaths in the UK, and that's a staggering amount considering the many ways someone can die, be it road traffic accidents or the thousands of different conditions that we medical students have to learn about. So for these heart checks, GPs will use risk stratifying tools to further examine those with conditions such as atrial fibrillation, high cholesterol, and family history of cardiovascular disease, because as we all know, there is a big genetic component to it as well. Cardiovascular disease affects around 6 million people a year, and this poses a huge financial strain on the NHS resources, demanding around £7 billion per year. So like I said, with the key component being prevention over cure, the screening is aiming to prevent thousands of cases of cardiovascular disease over the next decade. And again, this is a continuation of the 5-year plan that was put in place in 2014, whereby early detection will identify those who are at high risk for conditions that are exacerbated by states such as high blood pressure. So here's the quote that has been taken from Professor Stephen Powers, who is the NHS Medical Director. Reducing lifestyle risks and treating high-risk conditions such as smoking, obesity, poor diet, physical inactivity are key to preventing serious ill health. And the NHS long-term plan will help people take positive action for their own well-being, while investing in life-changing services close to home when ill health hits. These heart checks have already been put in place. A £9 million pilot study in Lambeth and Suffolk was set to identify conditions before they even manifest in 1,400 people over a 12-month period. The group were not receiving any type of medication such as anticoagulant prior to screening, but after checking, 1,300 of these patients were started on anticoagulation plans. So anticoagulants are basically blood thinners which thin your blood just to prevent clots from forming essentially. So all in all, from this study, it was found that 93% of people were started on anticoagulant medication, and this acted as a gateway for other clinics to encourage screening with the result. So it's important to ask this question: what does early screening do to the NHS? The first point is that screening results in a reduction of disease progression and complications that might be really hard to sort of treat if they continue to manifest and progress and get worse. And the harder something is to treat, essentially the more money that you need to put in to treat the problem. And treatment is more effective when used early. So think of it like pipes, if you will. If you stop the source, you're going to stop all the water from going into the pipes downstream. I hope that makes sense. Essentially, treating something early on is far more cost effective and easier. Another point is that it reduces wastage of the NHS resources, and these can be put in more specialised areas of research like cancer. And it reduces mortality through early detection, This can be said for the cancer screening programs that are put in place in the NHS currently, such as cervical screening or breast cancer screening. So I think that's basically the three main hot topics that I wanted to discuss and elaborate on in this video. Like I promised, there are some honourable mentions. So for these, I just didn't simply have time to cover in this video, and I don't want this video to be a movie. So I'm just going to reel them off, and these are equally as important. The first one is the junior doctor contract, and second one, like I mentioned earlier, is the Charlie Gard case. The new opt-out organ donation system that was put in England in 2020, antibiotic resistance and increase in prescriptions, and what can we do questions. So the three most common ones could be, what can we do about long A&E waiting times? What can we do about GP shortages? And what can we do about winter pressures, in particular bed shortages? So that's it for the video. I hope you guys found that useful. If you did, please leave a like and comment what you want me to cover next. That's basically it, guys. Good luck with your interview. And you don't have to learn these things in depth. Just have a general idea, and make sure when you do talk about it, just have both sides of the argument. And in the end, you can give your opinion. Okay, so I think that's it. Cool, peace.